Most people over 60 believe their heart is a chest problem. Your cardiologist checks your cholesterol. Your GP listens to your heartbeat. Your pharmacist counts your blood pressure pills. And somewhere in that loop, not one person asks you how your digestion has been. That is not an accident. It is a gap in how medicine is taught, organized, and billed, and it is costing people their lives. I want you to think about something for a moment. In the last 6 months, have you noticed more bloating after meals than you used to? Are your bowel movements less predictable than they were 5 years ago? Do you feel a kind of heavy fatigue that sleep doesn't fix? Has your heartburn gotten worse, or have you noticed sugar cravings that seem almost impossible to resist? Every one of those symptoms is your gut sending a message, and the destination of that message is not your stomach, it is your heart. Today, I am going to walk you through 7 specific signs that your gut is actively working against your cardiovascular system right now, signs that appear in a standard doctor's appointment with no connection made to your cardiac risk, signs that are dismissed as normal aging while the damage accumulates quietly over years. If 2 or more of these apply to you, keep watching. Do not skip ahead, the order matters. I'm Dr. Omosalua Adewale. I'm a senior health specialist. For over 22 years, I have focused on the intersection of aging, systemic inflammation, and preventable cardiovascular disease, specifically in adults over 60 who are doing everything they have been told to do and still getting sicker. This is the pattern I need to talk about today. After 60, your gut microbiome, the 38 trillion bacteria living inside your intestinal tract, undergoes a dramatic and largely invisible transformation. Research from the Human Microbiome Project shows that gut microbial diversity in adults over 65 drops by nearly 40% compared to adults in their 30s. And 40 seconds. That number alone would concern any scientist working in cardiovascular medicine. Here is why. Your gut bacteria do not simply digest your food. They manufacture compounds that enter your bloodstream, regulate your inflammatory response, communicate directly with your immune system, and produce or block molecules that your heart muscle depends on. This is called the gut-heart axis. It was considered fringe science 15 years ago. Today, it is one of the most heavily researched areas in all of preventive cardiology. Here is the specific mechanism that changes everything. When certain gut bacteria, the harmful strains that expand as diversity falls, process red meat, eggs, and certain processed foods, they produce a compound called trimethylamine. Your liver then converts that into TMAO, trimethylamine N-oxide. A landmark study published in the New England Journal of Medicine in 2013 found that elevated TMAO levels in the blood were independently associated with a 3-fold increased risk of major cardiovascular events, including heart attack and stroke, 3-fold, from a compound most doctors have never discussed with you, and that does not appear on a standard blood panel. Think of your gut lining as a security checkpoint. When that lining is healthy, it allows nutrients through and keeps inflammatory triggers out. After 60, that lining can become more permeable, a condition sometimes called intestinal hyperpermeability. When it does, bacterial fragments called lipopolysaccharides begin leaking into the bloodstream. These fragments trigger a chronic, low-grade inflammatory state, and chronic inflammation, maintained over months and years, is the single most consistent driver of arterial plaque formation, arterial stiffness, and ultimately heart disease. The body does not separate these systems the way our medical specialties do. The gut is not a separate department, it is upstream of the heart, and it is time we treated it that way. Let me show you the 7 signs that this process may already be happening in your body. Sign 7. Chronic bloating after meals. This is the sign most people laugh off. Bloating after 60, especially after meat, eggs, or high-fat meals, is so common it has been normalized out of medical concern. But here is what is actually happening when it becomes a consistent pattern. Persistent post-meal bloating is one of the clearest indicators of gut dysbiosis and imbalance between beneficial and harmful bacterial populations. When harmful strains dominate, they ferment food differently, producing excess gas and, more critically, generating the precursors to TMAO at higher rates. A 2019 study published in the journal Gut Microbes found that individuals with chronic post-meal bloating showed significantly elevated TMAO blood levels compared to matched controls with no bloating symptoms, even when their diets were identical. This matters because TMAO does not just indicate cardiac risk, it actively promotes it. It impairs reverse cholesterol transport, the process by which HDL carries excess cholesterol away from arterial walls. It also promotes the formation of foam cells inside arteries, the early cellular event, and atherosclerotic plaque development. The fix is not a probiotic purchased from a pharmacy shelf. a high-quality, multi-strain probiotic with at least 10 billion CFU including Lactobacillus rhamnosus and Bifidobacterium longum taken 30 minutes before your largest meal has measurable evidence for reducing TMAO precursor production. Fermented foods plain. Kefir, unsweetened kimchi, miso consumed daily provide living bacteria that shift the microbiome balance over 8 to 12 weeks. Write this down. If you have bloated consistently after meals for more than 3 months, ask your doctor for a TMAO blood test. It is not on a standard panel. You have to ask for it by name. Sign 6. Irregular or inconsistent bowel movements less than 1 bowel movement per day or unpredictable alternating patterns constipation 1 week. Loose stools the next is not a digestion problem in isolation. After 60, this pattern is a direct signal of bile acid dysregulation and that connects directly to your cholesterol and your cardiac risk. Here is the mechanism. Your liver produces bile acids to digest dietary fat. Those bile acids are then recycled by specific gut bacteria. When microbial diversity drops, bile acid recycling becomes inefficient. Excess bile acids are reabsorbed rather than excreted, raising LDL cholesterol and promoting inflammation in the intestinal lining. A 2021 study in Cell Host and Microbe identified that adults over 65 with irregular bowel habits showed significantly altered bile acid profiles compared to same-aged adults with regular bowel function, and those altered profiles correlated with higher cardiovascular risk markers. Beyond the biochemistry, constipation creates systemic inflammatory pressure. Bacterial endotoxins that should leave the body daily instead remain in prolonged contact with the intestinal wall, increasing intestinal permeability and raising circulating LPs levels. The fix that most physicians skip: dietary inulin. Inulin is a prebiotic fiber found in chicory root, leeks, onions, and asparagus. Unlike most fiber supplements, inulin specifically feeds Bifidobacterium, the strain most consistently depleted after 60. A 2020 trial in Nutrients showed that 10 grams of inulin daily over 12 weeks improved bowel regularity in adults over 65 and measurably reduced inflammatory markers. 10 grams is roughly 1 medium leek, 1 cup of cooked asparagus, or a teaspoon of chicory root powder stirred into warm water. Sign 5. Persistent bad breath. That brushing does not fix chronic bad breath, the kind that returns within hours of brushing and that no amount of mouthwash fully resolves, is frequently dismissed as a dental issue. After 60, it is often something more systemic. Helicobacter pylori, a bacterial infection of the stomach lining, affects roughly 50% of adults over 60 worldwide according to data from the World Gastroenterology Organization. H. pylori infection elevates systemic inflammatory markers, increases homocysteine levels, that same arterial wall damaging amino acid I have discussed before, and is associated with reduced stomach acid production, which cascades into nutrient malabsorption. A 2017 meta-analysis published in Helicobacter found that H. pylori-positive patients showed a 24% higher risk of ischemic heart disease than H. pylori-negative controls. Additionally, gut dysbiosis generates volatile sulfur compounds and TMA gas, the same precursor to mouth, that travel upward through the digestive tract. Persistent bad breath from non-dental origin is frequently one of the first detectable signs of elevated TMAO production. If you have been managing persistent bad breath for more than 3 months without dental cause, ask your doctor for a non-invasive H. pylori breath test. It takes 30 minutes and is not routinely ordered. Confirmed infection is treated with a brief course of antibiotics and is frequently reversible. The cardiovascular improvement that follows eradication is measurable. Sign 4. Intense sugar cravings or carbohydrate dependence. This is the sign that surprises people the most because it feels like a willpower issue. It is not. Certain harmful gut bacteria, specifically Firmicutes overgrowth species, metabolize sugar preferentially and signal the gut-brain axis to generate cravings for more of it. After 60, the ratio of Firmicutes to Bacteroidetes bacteria tends to shift dramatically toward Firmicutes dominance, particularly in individuals who consume processed foods regularly. A 2022 study in Nature Metabolism found that this bacterial imbalance is measurable in adults over 65 and directly correlates with elevated fasting blood glucose, higher triglyceride levels, and lower HDL metabolic profile that cardiologists recognize as a textbook precursor to cardiovascular events. Beyond the metabolic damage, chronically elevated blood sugar produces advanced glycation end products AGEs which bind to the proteins inside arterial walls, accelerating stiffening and reducing the vessel's ability to respond to blood pressure changes. This process is invisible on a standard cholesterol panel and is almost never discussed in a routine appointment. The fix does not begin with willpower. It begins with the bacteria. 2 to 3 servings per day of polyphenol-rich foods, blueberries, pomegranate, dark leafy greens, green tea preferentially feed Bacteroidetes species and starve out the firmicute strains driving the cravings, within 21 to 28 days of consistent polyphenol intake, the craving signal measurably weakens. This is not a long-term willpower battle. It is a bacterial environment correction. Sign 3. Food sensitivities you never had before. Developing new intolerances to foods you have eaten comfortably for decades: dairy, gluten, cruciferous vegetables, even certain fruits is one of the most telling signs of increased intestinal permeability. This is the process that researchers call leaky gut, and the connection to cardiovascular risk is no longer speculative. When the tight junctions between intestinal cells loosen as they consistently do with age, poor microbiome diversity, NSAID use, and alcohol bacterial fragments called lipopolysaccharides, or LPs, enter the bloodstream. Your immune system identifies LPs as a pathogen signal and mounts a response. Repeated LPs exposure creates a chronic, low-grade systemic inflammatory state, the same inflammatory state that drives arterial plaque instability, raises CRP levels, and accelerates the progression of atherosclerosis. A 2020 study in the European Heart Journal found that adults with elevated circulating LPs levels showed arterial stiffness scores comparable to individuals a decade older, independent of traditional cardiac risk factors including cholesterol, blood pressure, and smoking history. Your arteries were aging faster because of what was crossing the gut wall. The single most evidence-supported intervention for reducing intestinal permeability in adults over 60, L-Glutamine, 5 grams daily in warm water on an empty stomach in the morning. L-glutamine is the primary fuel source for the intestinal epithelial cells that maintain the tight junctions. Zinc Carnosine 75 mg. Daily has a second tier of evidence for gut lining repair. If you have developed unexplained food sensitivities in the last 2 to 3 years, this combination is where I would start the conversation with your doctor. Sign 2. Unexplained fatigue that sleep does not fix. Bone-deep exhaustion after a full night's sleep is one of the symptoms most consistently blamed on aging and most consistently misattributed. When gut dysbiosis is significant enough, it impairs the gut's production of serotonin, and more than 90% of the body's serotonin is manufactured in the gut, not the brain. Serotonin depletion directly affects sleep architecture. The body achieves less restorative slow-wave sleep regardless of hours in bed. At the same time, elevated TMA levels increase oxidative stress in cardiac mitochondria, the energy-producing structures inside heart muscle cells. When cardiac mitochondria are stressed, the heart works harder for each beat. The result is a fatigue that feels muscular and systemic rather than sleepy, because it is coming from reduced cardiac efficiency, not from insufficient rest. A 2018 study in JACC, Heart Failure found that TMA levels were independently predictive of exercise intolerance and fatigue in heart failure patients, and that elevated TMA contributed to measurable impairment in cardiac energy metabolism. This was not only in diagnosed heart failure patients. Elevated TMA is present in adults with no formal cardiac diagnosis who simply have poor gut microbial balance. The protocol: Riboflavin vitamin B2, 100 mg daily, supports TMA clearance in individuals with a specific genetic variant FMO3 that reduces the liver's ability to process it. Magnesium Glycinate, 400 mg at night, supports cardiac mitochondrial function and sleep quality simultaneously. Neither of these will reverse a severely compromised microbiome alone, but they address two of the downstream consequences while broader gut work proceeds. Sign 1. Worsening acid reflux or heartburn after 60. Here is the counterintuitive truth that most gastroenterologists and cardiologists never connect in the same conversation. Acid reflux that worsens after 60 is almost never a problem of too much stomach acid. In the majority of cases in older adults, it is a problem of too little stomach acid production decreases with age, a condition called hypochloridria. When stomach acid is insufficient, the lower esophageal sphincter does not close properly, undigested food ferments in the stomach and generates pressure that forces partially digested content upward. The sensation is identical to excess acid. The treatment: prescribed proton pump inhibitors, makes the underlying problem worse, not better. And here is why this connects directly to your heart. Insufficient stomach acid means protein is improperly broken down, B12 absorption is blocked, magnesium absorption is compromised, and harmful bacterial populations in the stomach are no longer suppressed. Every one of those consequences, B12 deficiency, magnesium deficiency, bacterial overgrowth, carries independent cardiovascular risk. A 2019 population study of over 200,000 adults published in PLOS Medicine found that long-term proton pump inhibitor use was associated with significantly elevated risk of cardiovascular events, independent of the conditions for which the medications were prescribed. The mechanism was partly through B12 depletion, partly through magnesium depletion, and partly through the microbiome disruption that follows sustained acid suppression. Before your next reflux appointment, ask your doctor this exact question. Could this be hypochlorhydria rather than hyperacidity, and would a low-dose betaine HCl trial be appropriate? 1 tablespoon of apple cider vinegar in warm water 15 minutes before meals supports stomach acid production in individuals with hypochlorhydria. Inexpensive, widely available, and frequently more effective than a 20 mg omeprazole tablet for the actual underlying mechanism. I want to tell you about Margaret, 68 years old, retired librarian from outside Columbus, Ohio. The kind of woman who spent 34 years making sure other people had what they needed and never once asked for the same in return. Margaret came to me after 3 years of progressive fatigue, worsening acid reflux, and bloating. That had reached the point where she was afraid to eat meals in public. 3 different physicians, 2 gastroenterologists, 1 cardiologist who ran her cholesterol panel, found it acceptable, and told her, and I am using her exact words, "Your heart looks fine on paper." She was 65 when the symptoms began. By 68, she was sleeping 10 hours a night and waking exhausted. She had stopped walking her neighborhood because the effort felt disproportionate to what it used to require. Her family attributed it to grief. She had lost her husband 2 years prior. Her doctors attributed it to age. Margaret herself had started to accept that this was simply who she was now. When I reviewed her full history, not just her medication list, not just her cholesterol, I looked at her symptom pattern as a connected system. The bloating, the reflux, the fatigue, the food sensitivities that had appeared in the last 18 months, the sugar cravings she was embarrassed to mention, 5 of the 7 signs presenting simultaneously for 3 years with nobody connecting them. Her TMAL levels, when we finally tested them, were in the top 15% of adults her age. Her intestinal permeability markers were elevated. Her B12 was deficient, not flagged because it was technically within range at the bottom of that range. Her magnesium, the same story. We did not add medications, we removed one. The PPI she had been on for 2 years, tapering it carefully over 6 weeks while addressing the actual underlying acid production. We added a targeted probiotic protocol, inulin-rich foods, L-Glutamine, Magnesium Glycinate, Sublingual B12. 4 months later, Margaret called my office. I want to tell you exactly what she said because it is the reason I am still doing this work. She said, "I thought I had become an old woman. I didn't know I had just been starving my gut." She is walking 3 miles a day now. She went back to volunteering at her local library twice a week. Her cardiac inflammation markers at 6 months were measurably lower. No new prescriptions, no procedures. We simply gave the upstream system what it needed. Your cardiologist is not wrong to look at your heart, but your heart is not the beginning of the story. It is where the story ends if the upstream damage is never addressed. The research connecting your gut to your cardiovascular system is not new. It has been accumulating in peer-reviewed journals for over a decade. But somewhere between the laboratory and the 12-minute appointment at your GP's office, the conversation never happens. It is not because your doctor doesn't care. It is because the system rewards treating symptoms, not tracing origins. You now have the 7 signs. You have the mechanisms behind them. You have the questions to ask. What you do with that tonight, not next week. Tonight is entirely up to you. A diagnosis is not a destination. It is the beginning of a conversation, and you are now equipped to have a better one. Your gut-heart protection checklist. 7 signs, 7 first steps. Sign 7: chronic bloating. Requested a MAO blood test. Begin a multi-strain probiotic and add 1 daily serving of fermented food. Sign 6: irregular bowel movements. Add 10 grams of inulin daily. Leaks, asparagus, chicory root powder to selectively feed Bifidobacterium. Sign 5: persistent bad breath. Ask your doctor for a non-invasive H. pylori breath test. It takes 30 minutes. It is not routinely ordered. Sign for sugar and carbohydrate cravings. 2 to 3 daily servings of polyphenol-rich foods, blueberries, pomegranate, green tea to rebalance the bacterial population driving the cravings. Sign 3: new food sensitivities. Discuss L-Glutamine 5 grams daily and Zinc Carnosine 75 milligrams with your doctor as a gut lining repair protocol. Sign to fatigue sleep does not fix. Ask about TMAO testing. Add Magnesium Glycinate 400 milligrams nightly and discuss Riboflavin 100 milligrams daily. Sign 1: worsening acid reflux. Ask your doctor directly, could this be low stomach acid rather than excess acid? Before continuing or starting a PPI, do not attempt all 7 at once. Pick the one sign that resonates most strongly with your experience right now. Start there. Sustainable change comes from one small decision, repeated consistently until it becomes invisible. Write these 3 words at the top of a piece of paper before your next doctor's appointment. Where does it start? Every symptom has an origin. You deserve a physician who is willing to trace it. Which of these 7 signs do you recognize in yourself? Tell me in the comments below. Type the number 1 through 7 that describes something you have been living with and dismissing as normal aging. I read every comment on this channel. And how many medications are you currently taking? Just type the number, no names required. That number alone tells me something important about the conversation we may need to have next. There is someone in your life, a spouse, a sibling, a close friend, someone over 60 who has been told their fatigue, their bloating, their reflux is just part of getting older. Share this video with them. One share, you may be handing them the beginning of an answer they have been waiting 3 years to find. If you found this useful, please subscribe. Every week I bring you evidence-based information about the systems that determine your health after 60, information I wish every patient had access to long before they needed a procedure. Everything I have shared today is based on published research and my clinical experience as a senior health specialist. It is not a replacement for your personal medical care. Every person's situation is unique. Please do not stop, reduce, or add any medication or supplement without speaking first with your own physician. Bring these questions written down to your next appointment. Your doctor is your partner in this. Give them the chance to have the complete conversation with you. Take care of your gut. It has been working for your heart every single day without recognition. It is time we paid attention.